we are at an awesome tipping point in healthcare. Not because electronic medical records are great. In fact, I know how much electronic medical records are not that great. However, because much of the world is now digital, it gives you the opportunity to actually begin to fill out your chart on behalf of your providers. Not having people spelunk through a bunch of different systems and make phone calls and manage fax machines and all these other sorts of fun things. If you have a partner, a set of technologies, a set of tools that is proactively trolling everything that's going on in your marketplace and curating and building out that chart for you, think about how much better you're going to feel when standing in front of a patient. You've actually got a full picture of what's going on for that patient, far better than you ever could have in a world of paper, and certainly far better than everything. If all you're looking at in your chart is the stuff that you typed into the chart, that's not super helpful. Whereas if you have all of that information plus the masses of information from across your community, you start to get a much more interesting thing. This is an example of our version of this, where we're going to troll everything that's going on in your geographic market and find out everything that we can about your individual patients. Our presentation of it looks like this. But more importantly and more broadly, as you think about a technology strategy for your practices, there's great energy behind the notion of interoperability. I don't know how much you have followed the legislative game that's going on and this idea that certain either health systems or vendors are doing information blocking in pursuit of their own financial gain. But you're seeing significant levels of uptick literally just in the last 12 months. This is really, I mean, I've been chasing this for 20 years. I know how much of a pain in the rear that it's been. So the idea that we're actually getting uptick on this is really good. Share with you, demand this of your technology providers, demand this of everybody in your marketplace. There's real opportunity here to reduce the amount of churn you spend, the amount of time you spend on these things, and to provide a better care. And lastly, and this might be the most self-serving, I don't really know, gone are the days where you should be buying servers. Gone are the days where you should be paying for interfaces. Gone are the days that you should worry about upgrades and updates. That should never happen again. Right? Healthcare routinely falls a couple of decades behind most modern industry. The internet is real. The notion of service-based technology deployments is real. Athena's not the only one by any stretch of the imagination. You should rest assured that you can't build up an IT competency strong enough to keep up with all of this regulation. You just can't do it. There's plenty of opportunity in markets to take advantage of these things. It will reduce the amount of time you spend on technology. It will improve the time to value for your patients and for your practice. It's my thread on tools. I'm going to move a little bit and talk about resources now. So again, just to recap on tools, you have a real opportunity in terms of standards-based interoperability to curate your chart. You have a real opportunity to leverage technology as a service instead of paying on a capital basis for a bunch of things. You have a real opportunity to take advantage of best practices and data. There are plenty of these things out in market that can help you run your practice. From a resources perspective, I'm going right at that purple bar, right? That annoyingly large increase in the administrative burden. And I'm going to motivate this again. I mentioned that I'm an economist by training, and I motivate this through an economic theory. And that economic theory is comparative advantage. This is a remarkably simplistic representation of what I mean by comparative advantage. The simple story is if you are 6'6", you are going to be better at picking apples off a tree than somebody who is 5'3". Likewise, if you are 5'3", you are going to be better at picking strawberries off the ground than somebody who is 6'6". Find that what you're good at and focus on it is the notion of comparative advantage, and then you set up a bunch of trading relationships with those around you to help you do a better job. We all know there's a significant administrative tax in the day-to-day running of a practice, so the idea is, can you do certain things way better than others in your market, or do you have partners that can do certain things way better than you? When we look at our network, just to further motivate this notion of administrative tasks, we see about 1 billion tasks per year that are put on our clients. About 1 billion. Okay, now we have 100,000 clients. There's about 10,000 or so tasks that we put on each one of our clients, each one of our providers, every year. You can see the types of things you're doing. I've got coding tasks. I'm doing revenue cycle stuff. Despite the fact that we now have 80% EMR adoption across the United States, it turns out that our average doctor gets 1,300 pages of faxes per month. That doesn't make any sense. but nevertheless, that's the real work that's required in the practice. So the degree to which you've got people focusing on these things, there's a lot of administrative work. Now, technology can help with this, okay? I'm going to talk about a couple of different things that fall into this category. Number one, I don't know how much you follow technology headlines, but things like machine learning, things like artificial intelligence, the idea that we're getting all of this inbound paper from all of the trading partners into your practice and from your patients and from hospitals and for others, you can use technology to automatically read those things. Okay? We get about 200 million such documents per year, just by way of example. Our math shows that if you can find a partner to do this type of work for you, you're going to save 200 hours per year per provider. That's nearly 5 weeks of applied time per provider within the organization, just to keep up with the paperwork associated with this. A very, very significant administrative savings. These are the types of things that technology can do that aren't oftentimes talked about. One of the fundamental principles that we see is, no longer should technology in healthcare be about the feature and function, right? If I click here, this happens, and rather, are we focused enough on the jobs to be done, right? Do we know what outcome it is that we're seeking to achieve? And is the technology you're seeking for your practice actually going after those end results and doing a good job? There's real opportunity within this. This is just one example, right? There are plenty of examples that others in market can do as well. Another perfect example of this idea of comparative advantage is find things that you are doing, but you're doing them at subscale, right? It turns out that if you have a half a person for every provider in your practice focused on authorizations management, but they only do it maybe 15 hours a week, right? They're never, ever going to be as good as the person that's all they do. Right? If you do authorizations all day, every day for 40 hours a week, you're just going to be better. You're going to be better and more efficient than somebody that does it off the side of their desk. Whether that's in authorization management, whether that's in coding, you have the opportunity to look at all of these jobs to be done within the practice and say, look, I don't need to do these. This is not in the strategic interest of how it is that I care for my patient and how it is that I think about what I'm doing. I'm going to find a partner to do some of those things for me. Another example of leveraging that principle of comparative advantage. We talk a lot in our business about, are we practicing to the top of our license? Meaning, a physician should not be doing things necessarily like checking weight, giving flu shots, so on and so forth. Your technology provider should help you. We need to be able to sift through the types of work necessary to support all of the day-to-day jobs within the practice. And if we shift work from person A to person B and we do so in a smart way, maybe it's done with a partner of yours, maybe it's done to another third party, it doesn't matter, but the idea of being smart about how it is that you distribute work represents another real opportunity in this world. Let's skip through this. Lastly, one of the things that I think is most important, I think you've got some great partners here that you're looking at across LACMA is interesting. The advent of the consumer age in healthcare is hard to predict from a timing perspective. There is no doubt about that. However, I think it's safe to say that you're going to need to have a competency about engaging, activating, and meeting patients where they are. Right? If you think about not just motivating gaps in care today, getting attribution depending on the types of contracts that you've got, or just wanting to do the right thing by way of engaging your patients more deeply, building a consumer-oriented mentality would be hard for you to do on your own. I can't imagine what it would be like to have 3 physicians in your practice and to try to build this type of capability. Find a partner that has hired people from Amazon, from TripAdvisor, from other consumer-oriented websites, where they know things like, well, if I send an email in this way, and that's path A. If I send an email in this way, it's path B. I'm going to compare them. I'm going to figure out which one of those is more effective. I know that if I send somebody a text, that they're more likely to pick up the phone when I call them that night to remind them of their upcoming appointment. I know that if I don't use a flowery HTML email and rather I use straight text, they're more likely to respond to my desire to engage them in their care. So my advice to you on this front is find a consumer marketing thread and bring it to bear within your practice. There's ample opportunity. I've shared a couple of examples here in terms of how we think about it. How can we activate patients in need of care gaps? How can we get people engaged? It's hard to motivate patients to actually care about some of these things. I would suggest this is one of the more important things you can do for your practice. And then lastly, I'm going to close with the autonomy thread. And I think I've got some really fun data here. I'm attempting to close on a high note because there is this malaise in market about what is the future of independent practice. And hey, Paul, you've got this interesting data. You've shared some ideas on technology. How is it that you can help me stay independent? First thing I'd share with you is of those 110,000 some odd providers, this is what we're really good at. This is what we think about. Our base of independent providers has grown by 20% while the market has shrunk to the tune of 5%. So we care deeply about this, and we know a lot about this. We have taken that data I talked about and done a significant level of analysis. This is the best thing I can share with you, which is private practices are better. They're empirically better than practices that are employed without an equity interest by a health system or otherwise. They're just better. And you can see that with respect to that. But the data, and it's not even just one financial metric, right? We've actually got data that shows. So the way to read these are independent groups are the purple bar, bigger groups are the yellow bar, and big enterprises are the red bar. And I've got 4 classes of data and performance to look at here. Productivity. Work RVUs per provider day. Not the perfect measure, but bear with me because it's setting up the storyline right. How good are we at engaging and collecting our patients? Patient access-wise, how good are we at activating them and getting them in? Specialty-adjusted time to third available appointment. That's a proxy that we use for patient access. And then patient loyalty. How often are they returning? In every single one of these, there's an advantage. Now, some of them is not surprising, right? Productivity, well, yeah, if I'm not salaried, I'm going to care a lot more about being productive. I'm going to care more about it. Well, some of them are just flat out befuddling, right? The fact that an independent practice with a fraction of the number of doctors in a big health system has a better patient access strategy is crazy. It's awesome, right? It tells you that patients actually care. And you see that with respect to retention and loyalty as well. So the money shot here is you've actually got the data is on your side, right? It doesn't feel like it every day, right? We know there's significant levels of complexity in doing all these things. Oh, I forgot to do the animation, sorry. The other one, this one I already talked about, but same thing in terms of physician retention. I will tell you, I had the opportunity to talk to a lot of health systems. They struggle mightily to keep those physicians engaged. So people might believe they're seeking safe harbor, but I can tell you they're not happy. They are not happy, and you see it in the retention rates across all of that. So with that, hopefully I've offered a couple of words of wisdom, both of inspiration and perspective. Hopefully you've got a couple of ideas of technology. Again, this wasn't intended to be an Athena commercial, but rather being thoughtful about not just buying the features and functions of an EMR, but rather thinking intentionally about the jobs to be done. And be proud, right? The role of the private practice drives better results than that of the employed provider, and that's a huge feather in your cap. Thank you guys so much for having me. I really appreciate it.